I'm sure everybody knows that all of Trump's nominees for cabinet positions and other federal posts, besides being millionaires, are either former generals or affiliated with Goldman Sachs. But did you know that all of them are vehemently opposed to abortion rights, which means they're anti-women? No wonder the attacks on women's rights, particularly on reproductive justice, began as soon as the 115th Congress convened. House Speaker Paul Ryan announced January 5th that the goal of defunding Planned Parenthood was part of the impending budget bill, which would repeal the Affordable Care Act. No replacement program for the Affordable Care Act has been proposed. Major problem. Planned Parenthood is targeted because it is a national provider of abortions, though that service is only 3% of Planned Parenthood's annual revenue, and there has been no federal funding for abortions since the Hyde Amendment was passed in 1976. Meanwhile, Planned Parenthood provides 2.8 million women and men with a variety of reproductive health care services annually, including birth control, sex education, cancer screenings, as well as tests for sexually transmitted diseases. Those who oppose safe, legal, accessible abortion make defunding Planned Parenthood sound deceptively easy. It's just cutting funds for Medicaid reimbursements. Sounds simple, right? Just cut the money. According to Planned Parenthood, about 75% of the $553 million it received in federal reimbursements in 2014 was through Title X funding via Medicaid. Over 2/3 of Planned Parenthood's patients rely on Medicaid for health care. So what defunding Planned Parenthood means in human costs means that it will be devastating to the poorest of poor women and men in this country. Predominantly women of color, youth, immigrants, women with disabilities, survivors of domestic violence, and rural residents. They are the ones who rely on Planned Parenthood for essential health care, who would have to pay out of pocket, look elsewhere for services, or go without. And of course, going without would create catastrophic social problems, because alternatives to Planned Parenthood don't exist for people who make 52 million visits a year to more than 700 Planned Parenthood clinics all around the country. Last year, when anti-abortion zealots gave Congress a list of alternative providers of reproductive health care, a quick survey exposed the list was a total sham. City health centers were completely unequipped to provide such services. Responding to Ryan's announcement, Cecile Richards, president of Planned Parenthood, was quoted as saying, "You can't completely end a public health care system in this country," she said something else, "and not think about what the impact will be on folks who have least access to care." Judith Solomon, Vice President for Health Policy at the Center for Budget and Policy Priorities, added that defunding Medicare would dismiss and dismantle decades of work to ensure that low-income women have ready access to family planning. So that exposes what they're trying to do with Planned Parenthood. Total and complete attack on poor women. And who are they? Women of color, immigrants, youth, women with disabilities, women who are survivors of domestic violence, and rural women. So, now we're going to go to the Affordable Care Act. Repealing the Affordable Care Act will immediately cut health care access for 20 million people who gained insurance when Medicaid coverage was increased in 31 states. According to PolitiFact, repeal could lead to increases in the number of newly insured Americans, people facing difficulties because of pre-existing conditions, the size of the federal debt, ding, 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 and how much money people will have to pay for health care. One reason the right wing can't wait to get rid of the ACA is because all costs of contraceptives are subsidized under the law. This issue created havoc in about 2010 when some businesses raised, quote, religious objections to covering birth control. In 2014, the Supreme Court ruled in their favor, but they were able to make a workaround, and the ACA exemption remains a real bonus for millions of women. Without such coverage, who knows how many unplanned pregnancies might occur, leading to an increase in abortions, which, by the way, have been declining. The decline, it turns out, is not due to state government restrictions, which have proliferated, but to long-term contraceptives, which tend to be quite expensive. An IUD can cost over $1,000. So it's not something that women who make $7.25 an hour can have access to, but it is if it's free. Anyway, a Guttmacher Institute study observed, quote, the overall rate of unintended pregnancies dropped 18% between 2008 and 2011, its lowest in 30 years. The study concluded these findings have major implications in the U.S. abortion debate as they validate that supporting and expanding women's access to contraceptive services leads to a lower incidence of abortion. Now, any woman knows that, but these guys who are putting these laws through could care less. The way the ACA is linked to the Medicare program also means repeal would drastically increase costs for 57 million seniors and disabled. According to a Kaiser Foundation brief, the Congressional Budget Office has estimated that the full repeal of the ACA would increase Medicare spending by $802 billion from 2016 to 2025 by restoring higher payments to health care providers and Medicare Advantage plans. The increase in Medicare spending would likely lead to higher Medicare premiums, deductibles, and cost sharings for beneficiaries. Hospitals would be swamped with sick people who don't have any insurance, creating a national crisis in health care delivery. And thousands more people, including and especially many people of color, would die each year due to lack of care. And we cannot stress that enough. This is a total racist attack, a sexist attack, an anti-LGBTQ attack. And they're doing it because they have the power to do it. They don't want health care for everybody. They want to repudiate a health policy that says health care is a right, not a privilege. They don't want to concede that. They don't want to pay for it. Now, good news. We got some resistance going on in this movement. There is a group that has been working to overturn the Hyde Amendment, which I spoke about earlier. And part of the Trump-Pence administration is to make the Hyde Amendment permanent. Now it's got to be renewed every year. Hyde does not allow abortions for women on Medicaid to be paid for by the federal government. 17 states do it now. New York State is one of them. But the federal government pays nothing. That denies reproductive choice to 12.9 million women of childbearing age, who are 61.8% of the adult female Medicaid enrollees. So families, nearly 60% of women who have abortions are already mothers, must make really hard choices to pay even fees that can be as low as $375. If you're making $725, it's really hard to get together $375. And I've heard some amazing stories about women hawking their wedding rings and just stuff like that, selling jewelry that they inherited from a grandparent or something. Anyway, all above all, a coalition led by young people and people of color was founded in 2014 to overturn the Hyde Amendment. All Above All has launched a new campaign opposing Hyde. It did so on January 3rd. It's "We Will Be Bold, We Won't Be Punished" campaign, and it seeks to stop the Trump-Pence agenda, which is trying to shame, bully, and punish poor women who have abortions. The campaign was launched to reinforce an open letter to Trump by 100 members of Congress on January 19th, calling for the elimination of the Hyde Amendment. The letter promotes the Each Woman Act, which was introduced by Representative Barbara Lee, a Democrat from California, in 2015, which seeks to lift the ban. And by the way, today, I got a press release from her saying that she was going to boycott the Trump inauguration because she didn't want to celebrate or seem to approve of any of his policies. It's a very long and very, very strong statement. I don't know if people are aware of this, but she's a black representative, and she was one of the few who voted against the war in Iraq. So, by disrespecting, this is a quote from Kira Johnson, Executive Director, Unite for Reproductive and Gender Equality. By disrespecting poor women, anti-abortion politicians are disrespecting all women, and we will not stand for that. Calling the campaign a rally for resistance, Destiny Lopez, who is the All Above All co-director, noted in a release on January 9th, there are many reasons to oppose Hyde: because you support abortion rights, because you think poor women shouldn't be discriminated against, or simply because you don't think politicians should interfere with our personal decisions by taking away coverage. Couldn't sum it up any better. Will racist, patronizing patriarch Trump and reactionary evangelical Pence get the message during the Women's March on January 21st? We don't think so. What's most important about the Women's March, as Monica said, is that it's highly likely that the united spirit, solidarity, and determination generated by millions of women in the U.S. and around the world will energize them and others inspired by them to continue fighting for the full spectrum of human rights for women, for women's liberation.